So welcome everybody. We're really excited today to have a program on reproductive rights, the path forward. And this is brought to you jointly by our Justice and Health Committees. Today we have a wonderful panel of folks, an esteemed panel who are reproductive experts with years of activism and advocacy experience. We have Assemblywoman Cottie Petrie-Norris, who represents the 74th Assembly District, which is the Orange County Coast. We have Shannon Olivieri Hovis, who is the director of NARAL. We have Jessica Pinckney Gil, who is the executive director of Access, Reproduction Justice, and Bethany Golden, who is a registered nurse and a certified nurse midwife. And we're really looking forward to hearing what they have to say about reproductive rights and the path forward. So I believe that we're starting with Assemblywoman Petrie-Norris.
Hi, everyone. Thank you so much, Anne. Good morning. It is a pleasure to be able to join you all today on this really, really important topic. I am Assemblywoman Cottie Petrie-Norris, and as Anne said, I represent the 74th Assembly District, which is in Orange County. So really thrilled for the innovations of Zoom that we're able to gather like this from all parts of the state. I think that we all recognize that this is a really scary moment in America. As we've seen all across the country, reproductive rights are under assault, and there are powerful forces working overtime really, really to drag us backwards, frankly, on a number of fronts, but certainly when it comes to reproductive freedoms and our reproductive rights. And I do believe that in the face of all of this, California has been and certainly will continue to be a beacon of hope. And I guess if there's one message I want to leave you with, it is that California is fighting back with absolutely everything that we have. We are fighting back against this assault. So I'm proud to be a member of California's Legislative Women's Caucus, and we are working to protect and expand reproductive health care across California. And I think, certainly when Roe was overturned, it was like a punch to the gut, but we did see this coming. And back in January, at the beginning of this year, my colleagues in the Legislative Women's Caucus and I introduced a package of 13 bills, all of which have made it through the legislative process, and all of which have been sent for a signature to Governor Newsom. A number of them have already been signed into law, and a number of them are pending signature. Just a brief overview on our reproductive freedom package. It includes laws that will eliminate cost sharing for abortion services, provide civil liberties protections for California clinicians who provide abortions to patients from states like Texas, Missouri, Oklahoma. I feel like the list just keeps growing. And also a bill that will expand California's reproductive health care workforce. And I co-authored all of the bills that are part of our reproductive freedom package, and I am the lead author on AB 1918, which is going to establish the California Reproductive Health Corps. This bill will greatly strengthen our healthcare education pipeline by recruiting, training, and retaining a diverse workforce of medical professionals, from doctors, nurses, licensed midwives, doulas, and more, who are trained in reproductive health services, which includes abortion care, as well as maternity care and miscarriage management. And I sometimes have folks ask me, why is that needed? Why is that needed here in California? And I think people are really surprised to learn, and I'll tell you, I was as well, that in 40% of California counties do not have a single abortion provider. And I think when we couple that current reality with the anticipated, and we're already starting to see the influx of patients from other states, there really is an urgent need to expand our reproductive healthcare force. So was really, really proud to author this bill this year. And we were able to secure $20 million in the state budget to fund the program. And that funding is part of a $200 million investment, which was also championed by the Legislative Women's Caucus to bolster California's reproductive healthcare infrastructure and expand access to care. Alongside that work that we were able to do this year in our legislative session, we are working in lockstep with Governor Newsom, Lieutenant Governor Eleni Kounalakis, legislative leadership, leaders and advocates, including Shannon and other folks you're going to hear from today, to pass Proposition 1, which is the constitutional amendment that will enshrine the right to abortion in California's constitution. And Prop 1 will ensure that abortion remains safe and legal here in California by putting that right explicitly in our Constitution, which will ensure that our rights are secure no matter what politician is elected to power. Another important component of Prop 1 is that it also explicitly protects the right to contraception, which, while it is kind of unbelievable that we're having to say this, we also believe, and there's certainly been signals from members of the Supreme Court that that right could also be under threat. So as I said, we here in California, we are fighting back. We're working hard to stay one step ahead of the anti-woman, anti-freedom, misogyny, and misogynistic agenda of the far right. One example, actually, just from the very end of session, I think people probably saw in the news, gosh, maybe about a month ago, a terrible story. I believe it was a young woman in Tennessee who she had sought an abortion care in order to terminate her pregnancy. And she had corresponded with her mom on a Facebook Messenger app. And law enforcement seized those records and used those records in order to prosecute her for a crime under the newly adopted law that bans abortions. So again, we quickly sprang into action here in California, and my colleague, Rebecca Bauer-Cahan, at the very end of session, revised a bill that had been moving through the process and proposed a law that will now prevent California-based technology companies from disclosing user information to out-of-state law enforcement agencies who are seeking to prosecute someone for obtaining or providing an abortion. So that is, I think, just one example of the ways in which we are having to be really nimble and really responsive to make sure that we are doing everything in our power to protect women here in California and women all across America. We're fighting back. We're fighting back in California because here in California, we believe that decisions about your body don't belong to Ron DeSantis or Mitch McConnell. That decision belongs to you. And here in California, we believe that the decision about whether and when to start a family, that doesn't belong to Brett Kavanaugh or Samuel Alito. That decision belongs to you. And I know that we cannot win this fight without you. So I want to thank you all for your engagement, all for your work. Thank you for your endorsement of Prop 1. I think it's really hard, I think, for so many of us to fathom that we are in this place right now in America in 2022. So I was born in 1975. Roe was 2 years old when I was born. It's a right that I and so many of my contemporaries, so many of my peers have known all our lives. And the idea that we are raising sons and daughters, that we're raising our children in a world where they're going to have less rights than we do today is horrifying. And it really is, I think, one of the first times in American history where we're seeing this rollback of our rights. So we know that we have got a tough fight ahead of us. We know we must win. And I really, really do believe that we will win. So I want to thank you for being part of that fight and part of this movement to make sure that we are continuing to protect and to expand reproductive health care here in California and across the country. Looking forward to hearing from our other panelists and to diving into your questions for the rest of the conversation. Thanks again for inviting me to be part of this.
Do you want me to jump right in, Anne? Or do you
I
want
was just going to say thank you so much, Cottie. Oh, goodness, technology. Yes, Robin, please.
Well, this is Shannon, actually. Do you want me to? Okay, I'll jump right in. Great.
Oh, hi, Shannon.
Hello. Hi, everybody. So first, I just want to thank you for having us, and thanks to the Assemblywoman for being here. She's absolutely right about this moment and how critical this moment is, obviously. A little bit of background on me. I'm Shannon Olivieri Hovis. I'm the director of NARAL Pro-Choice California. I've been at NARAL for about 4 years and previously worked in the California Department of Justice for several years, in the executive office of Kamala Harris when she was the Attorney General. I worked in the state legislature before that, and so sort of have a long history of working on policy and politics in the state of California. So I want to talk a little bit about NARAL. I think probably many of you are familiar with NARAL, but NARAL is the oldest and largest abortion rights advocacy organization in the country. We've been fighting for reproductive freedom for more than 50 years. And reproductive freedom means the ability to make personal decisions about our reproductive lives and futures, free from any form of oppression and free from government interference. And so that's what we've been fighting for. That includes across the board, right? We are fighting for abortion rights. Obviously, we're also fighting for contraception, and we're fighting for paid family leave, and we're fighting for, fighting against pregnancy discrimination. We're fighting, really what reproductive freedom truly means as it relates to the ability to prevent, to have, and then to choose abortion. We are a membership organization. I think that that's critically important to the work that we are doing. We have 4 million members nationally. We have more than 370,000 members here in the state of California. And in California, we're almost as old, actually. Our presence here in the state is almost as old as the national organization. We've been here for a long time, formerly KRAL, for some of you who followed us decades ago. So, I think the Assemblywoman said a lot of it, and I will kind of give a little bit of numbers to some of what we're seeing nationally. So right now, there are abortion bans in effect in 14 states. And do you want to see if you can mute Linda? I don't know if that's just for background noise for folks. Perfect, thank you.
Yeah, I got it. Sorry about that, yeah.
Thank you. Thanks, Robin. So we have 14 states that have abortion bans in effect. Now, this is a constant moving target. I think that's important to know, and that's because some bans are getting stopped in the courts right now. Others are going into effect. The numbers are almost changing daily. We expect about half of the states to ban abortion entirely or almost entirely in pretty short order here. And we are talking about, half of the women of reproductive age in the country living in states where they have limited or entirely prohibited abortion access. So the moment is very dire. One thing I think is important to mention, of course, is we are coming up on an election. And reproductive freedom is on the ballot. It is literally on the ballot in many places in California, of course, with Prop 1 in Michigan as well. We just saw the outcome of the ballot initiative in Kansas. So a lot of what happens on the national scale and what that actual landscape of access looks like is dependent upon the outcome of this election and whether we're able to protect access in states like Michigan by keeping the elected leaders there in place. So, and I talk about that, obviously NARAL is a political organization, but elections, as you very well know, with all of the advocacy you do around voting rights and making sure people are registered and turn out to vote, elections have real life consequences, and we're living with the consequences of that right now. California created the California Future of Abortion Council a year ago, before Roe was overturned, before the draft majority opinion came out in the Dobbs case. And we did that because we saw the writing on the wall. First warning sign from the Supreme Court was when they decided to take up Mississippi's 15-week abortion ban in the first place. Second major red flag was they allowed Texas's SB 8, their 6-week abortion ban, to go into effect last September, a year ago. So we already saw that they were very well poised to overturn Roe this year. And so we created the California Future of Abortion Council last September. We're coming up on the anniversary in about a week. And that council was intended to specifically interrogate California's legal system. What do our laws look like? What do we need to change? What additional protections do we need to put into place? To really look at our access deserts. What are the persistent barriers to care in California that we need to address? And how is that disproportionately affecting different people, right? We know that access is not equitable, even in a state like California. We need to dig into some of those issues. And as the Assemblywoman also spoke to, we have major access deserts related to provider shortages. And so Bethany will talk more about some of the specifics of some of that effort, but we need to ensure that we actually are building out our provider network, that we have a pipeline to do so, and also that we're supporting them, right? So one of the bills we worked on this year ensures that providers have adequate reimbursements when they're providing low and no cost care to patients, including patients coming from out of state who are uninsured, underinsured, or don't have insurance that transfers. The pieces of this puzzle, we convened this group that is researchers and advocates and policymakers, providers and patients, really trying to be as intentional and comprehensive as possible in looking at California. And a lot of people say, California, why is this? California's fine. Why is this needed? And even with Prop 1, we sometimes get, why is this needed? California's role in the fight for reproductive freedom has truly never been more important than in this moment. And that is because we already play, even before the fall of Roe, we have played an extraordinary role in ensuring people have access to care in the country. 1/4 before the fall of Roe, 1/4 of all healthcare facilities that provided abortion care in the country were in California. So now, obviously, as clinics are forced to shutter, as providers cannot provide care in states all across the country, the percentage of providers that California accounts for, facilities that provide abortion care that California accounts for, is going up exponentially. So the work of this council, we had a 16-bill legislative package this year. I won't get into more details about that at the moment. I'll let others elaborate and we can answer some questions as the panel goes on. But that work is ongoing. So the next immediate step, obviously getting the governor to sign that full package, which we anticipate he will, passing Prop 1 and sending a resoundingly clear message to the country that people, the vast majority of people in this country, support reproductive freedom and were appalled by the Supreme Court's decision overturning Roe. And then the next step is that council will be reconvening this fall and really looking at this evolving landscape and what we need to continue to do, what we need to do next year, what we need to do in future years in order to address this moment. And the last thing I'll say is, I do think that this is going to get worse, but then it's going to get better. And I feel confident about that. And I feel confident about that because of where public opinion is. Public opinion is very much on our side on this issue. We cite this statistic frequently. 8 in 10 Americans support the legal right to abortion. That doesn't mean 8 in 10 Americans would necessarily choose abortion for themselves, but they do not believe that that decision should reside with anybody else but that person with their faith, their family, and so forth. So I'll stop there. And it's nice to be with you all today. Thanks.
Thanks, Shannon.
And do you want to
Yes.
introduce Jessica Gil?
Yes. Hi, Jessica. Come on. Come on forward.
I was like, I'm
Trying to
ready.
get Nancy in. Hi, Jessica.
Hello. So good afternoon, everyone. I'm really thrilled to be with you this afternoon. My name is Jessica Pinckney Gil. I use she and her pronouns, and I'm the executive director at Access Reproductive Justice, which is California's only statewide standalone abortion fund. And I just wanted to share a little bit with you all today about what abortion funds do, how we operate, and particularly how we're operating in this moment. I will note, very grateful to be in the presence of Assemblywoman Petrie-Norris today, as well as my colleagues Shannon and Bethany. We've worked very closely over the last year around the legislative package that has been mentioned a number of times. So I probably will not touch on the future of Abortion Council and the legislative package quite as closely, but as Shannon mentioned, I'm happy to answer any questions during Q&A about that amazing group of bills and the many wonderful legislators that have helped us move that forward over the last year. But I really wanted to focus today a little bit on abortion funds. For those who may be less familiar, there are about 90 abortion funds all across the country. And essentially what we do is we operate health lines, text lines, email inboxes, a number of different mechanisms for folks to call and get the logistical, financial, and practical support that they need in order to make their abortion a reality. So Access Reproductive Justice has been in existence since 1993. And I always say that that's a really important point to mention, I think particularly in this, because folks think that the crisis we find ourselves in is a new crisis, and it is not. We were founded by clinic escorts who were working in San Francisco and saw that many folks were experiencing barriers to accessing care. And it wasn't just a matter of getting into the clinic safely. These were young folks, these are low income folks who needed additional support in order to be able to make their abortion a reality, whether that's transportation to and from the clinic, help paying for the abortion itself, an overnight hotel stay, etc. And thus the vision for Access Reproductive Justice was born, where we are not only providing information and practical support on all aspects of reproductive health care, but really working to build a community that's actively working to meet the needs of folks who are seeking those reproductive health care services. So we combine our direct services work, which is our Healthline, with community education and policy advocacy, as we've discussed here today, in the hopes of promoting real reproductive options and access to quality healthcare for people, not only in California, but who may need to come to California to access care. And so, as I said, we operate a Healthline Monday through Friday, where folks can call in and receive a number of supports that we offer. Those fall into two buckets, one being procedural support. So that's financial support paying for the abortion procedure itself. That can be medication abortion, that can be surgical abortion. It looks many different ways. We unfortunately are not able right now to fully meet somebody's unmet need, but we do have a pledge scale that we use And we work to try and fill that gap for folks as much as possible. We work really closely with clinics all across the state, and a few clinics in other states to try and make that process as easy as possible for our callers. So in a lot of instances, we don't even direct the funds directly to them. We'll pledge on their behalf to the clinic, and all of the finances are kind of sorted out on the back end. The other group kind of care that we provide, or support we provide, is practical support. And that looks like transportation, lodging, travel, childcare, food, doula support, etc. And that can really vary person by person. But I will note, even before the decision in Dobbs earlier this year, we had many people who traveled a great distance, both within California and from other states to California, to access the care that they needed. As many of us on this call know, California is a huge state. And as Assemblymember Petrie-Norris noted, there are a number of counties that have no abortion clinics at all. So folks have to travel sometimes a great distance, even within the state, to access the care they need. We often are supporting folks who are coming from the more rural parts of the state, who have to travel to a more metropolitan area to access care. That means they could have a 2, 3, 4, 5-hour drive from their home to the nearest clinic. And sometimes folks cannot afford the gas that's needed, don't have reliable transportation, etc. So we'll work closely with folks to provide either funds for gas or a bus, plane, train ticket. We've supported folks with renting cars in the past. And we do have a network of volunteers who can sometimes transport people to and from appointments. We also support folks with housing and lodging. Many of our callers are in their 2nd and 3rd trimesters of their pregnancy, which means often the abortion is a multiple day procedure. And in those instances, they would need to stay overnight near the clinic to be able to go back for the 2nd and 3rd days of their appointments. And so in those instances, we work with hotels near the clinics to get discounted rates and ensure that our callers can stay in those locations. That's another instance. We will cover the cost of a hotel, usually for 1 to 2 nights for a caller. And then again, we have a volunteer cohort who will sometimes provide additional financial support, covering an additional night of hotel if needed. We will reimburse folks for childcare, whether that means bringing their child with them to their appointment if the clinic allows that, or paying their regular child care person or a member of their family to watch their child, or a family member. We know many folks who are accessing abortion care have other family obligations, and so we try to support with those as much as possible. On occasion, we will connect people with a support person, an abortion doula, particularly if they're feeling nervous about the experience or not able to have a support person with them. We work to connect them with someone who can provide some emotional support. And we're, quite frankly, a listening ear. Particularly, I think in this moment, a lot of the folks we're supporting are coming from other states: Arizona, Texas, Mississippi, Louisiana, further and further, honestly, every day. And there's a lot of frustration that we're hearing on our Healthline at this point. And that's because people are having to overcome even more burdensome barriers that have been put in place since the Dobbs decision in June. Obviously, traveling by car from Louisiana to California is not ideal for folks to access what is basic health care. And so a lot of times what we're doing on our Healthline is not only providing the logistical and practical support people need to make their healthcare a reality, but providing that emotional support and understanding as well. And I will note the majority of our callers do identify as in their 20s, identify as low income, and identify as Black, Indigenous, or people of color. We are generally supporting folks who have already encountered many barriers to accessing care and are now seeing just a drastic increase in that. We know for many folks in other states, they're not able to leave the state. If you're a young person and you need parental consent to access medical care or to leave the state, you're essentially being forced into carrying a pregnancy you may not desire. If you are an undocumented immigrant, or your family has partial immigration status of some sort, you may not feel safe or comfortable leaving your state to access care. So there are many folks who were not even able to help in this moment and really are being forced into really undesirable circumstances. But for those we're able to help, we're doing everything possible. Historically, we've supported about 500 people per year in accessing abortions. But in looking at our January through June data of this year compared to last year, those numbers have already doubled. So we anticipate supporting at least 1,000 people in accessing abortion care here in California. And again, I think we're really grateful to the work we've done on the policy advocacy side as part of the Future of Abortion Council to ensure that every barrier we can possibly eliminate, not only for people coming from out of state, but also for Californians, is eliminated in this moment. We're incredibly grateful to the legislature and the governor for making investments in abortion funds, in practical support, which will really make sure that we can reduce these burdens for folks, that we're not only just providing $100 or $200 towards an airfare, but able to cover the full cost of the airfare, and so on and so forth. And this will really make people's lives so much easier and really allow them to access the healthcare that they need and deserve. And so that's just a little bit about Access Reproductive Justice. Like I said, we are one of 90 abortion funds all across the country. We work really closely with those funds whenever and however possible to make sure that we're easing the burden for folks who are coming from other states. And we've been around for decades, if not longer. And so I always really, particularly in this moment, like to caution folks when we're talking about creating new networks to house people, to drive people, to support people in these circumstances, because the organizations and the networks already exist. We've been doing this work for a long time. We have the infrastructure already in place, and generally just need increased capacity and financial support to meet this moment. But we really do have the infrastructure in place to make sure that we can keep people safe, and that we can work really closely to make sure that folks' full range of needs are met. So I will go ahead and stop there, but I'm looking forward to having more conversation with you all.
Thank you, Jessica. Nancy's still having some difficulty getting in here, so we're going to go ahead and ask Bethany Golden to speak. And Bethany is a registered nurse and a certified nurse midwife, as a practitioner and a policy consultant. And Bethany, Nancy asked that if while you're speaking, you could share how the fall of Roe has caused innovation to occur politically and clinically.
I would be happy to speak about that today. Good afternoon, everybody. First of all, I just want to let you guys know you have an incredible team of leaders in the state of California, and you are with three of them on this panel. Assemblymember Petrie-Norris, Shannon, and Jessica have really led the way so that we can move this state forward in a way that I don't think any of us ever saw coming. So specifically, as leaders on the Future Abortion Council in their everyday jobs, and Assemblywoman Petrie-Norris has literally understood very quickly the true barriers and act upon them, and harness the support of her colleagues to act upon them too. So I can't say enough about the other people on this panel. I am a clinician. I am a healthcare provider, and I think that there's two aspects of innovation that are going on. One of them is that, for instance, the state of Maryland is now enacting a law that we enacted 13 years ago. So to understand how California ripples across this country in terms of policy, and then of course implementation, we are the incubation lab for abortion. We are also that is happening in the clinician world as well. And what I mean by that, our clinicians are being faced with new issues post Roe v. Wade, which are fundamentally different in our role. One of them is what's called self-medication of abortion, something that is going on throughout the nation and had been going on beforehand, which is that we can now have the ability to access medication abortion through the internet and on telephone lines. In the past, clinicians controlled that whole interaction. A patient would come to a brick and mortar facility, they would consult with them, they would oversee it, they would do follow-up. Now we do some of that via telehealth, and then we also know that that medication abortions are going to happen without clinicians, but those patients still need support. So it's a very different lens for what our role will be, rather than being sort of the primary agent or perceived primary. This is a real fundamental shift to what patient-centered care looks like. So that's one challenge that clinicians are having. And it's also an exciting time because that needs to happen. The other place where clinicians are going to be really pushed is what information we ask for and what information we give to officials. And for instance, I'm a mandated reporter in the state of California. If people mention to me that they have some form of abuse in their home, there is a legal ramification of what I do next. That has also filtered in across the country in terms of how much information we need to know about someone's abortion. And what I mean by that is, in the state of Texas right now, does an ER nurse need to know all the details of taking pills and reporting that to the state? And is there a way that a frontline health provider can be satisfied with the answer that a patient might give them, which is, I'm having a miscarriage, and taking that and just moving forward with procedurally what will happen versus asking a whole history of clinical questions? That is another fundamental challenge to how we've been trained. And it's also very, very important for keeping patients safe. So on the clinical front, those are two places where we're being challenged. I have been very lucky. Like I said, 13 years ago in the state of California, midwives were given the right. We had proved that we were safe in performing first trimester aspiration abortions. 13 years later, there is no clinical pathway to achieve that for any mid-level providers. So what that means is that even though I've been trained to do medication abortions, I have no way to achieve that training. Now, I have had some of the best training that you can possibly have in this country. I went to Yale for my nursing degree. I'm at UCSF getting my PhD. I worked for Planned Parenthood. There's a lot of moments where you would have thought like, oh, well, if Bethany sought out first trimester aspiration, she could get it. There are not. And so one of the revolutionary concepts for the California Reproductive Health Service Corps, which is the bill that Assembly Petrie-Norris understood immediately and has advocated for and has authored, basically says, wait a second, we don't even have the ability for the people who have the legal scope of practice to do this form of abortion in the state, right? So creating those pathways is now what we're moving on towards after working with Teach to help get this policy into law and into the governor's desk. The next moment is we're already working on implementation. What does it mean to create pathways that are really comprehensive in reproductive health? Again, as a midwife, I had to deliver 30 babies, but because abortion is specialized, I never had the opportunity in my training to when I was doing IUD insertions and fibroids and everything else, abortion was happening in a different space. So unless you're in that space, you are not even seeing it as a provider. So where I'm going with this is that, you know, as we really understand these hurdles, and one of the reasons why these hurdles have now come to surface and we can understand them is that in the Future Abortion Council, we were all there together. And so some of the real practical issues really bubbled up, which could then be made and manifested into policy. And again, we have this beautiful constellation, right? We have a governor who's very supportive. We have an assembly. We have a supermajority. We have a very strong women's caucus. We have billions of dollars of surplus money this year. So that constellation, that political constellation, has really led us to a space that is one that I don't think that we ever thought we would see this state be as invested. We knew that culturally the values were all there, but the money and the laws being written are really big difference. So I'm happy to speak to more of these issues as we go on. It's a pleasure to be with you here today, and I look forward to our discussion.
Thank you, Bethany. We're going to go ahead and spotlight all of our speakers now and move into Q&A. I'm trying to talk and spotlight, which I'm new to, so here I am. And Nancy wanted to point out, we were saying on our texting, because that's the only way she can communicate, that that Jessica is 30 weeks pregnant right now. And so all of us who have been through that before can understand that at this point, this is quite amazing that you're still doing all of this, and you just seemed energetic and perfect and awesome. That's great. You're learning. That's what a mom does, right? A million things all at once. We were telling Nancy what an amazing speakers all of you are, and how lucky we are to have you. And Lynn and Ann are going to help me with the chat box, and we're going to do our best to get any questions that people have. Please type them in or put a question mark, and we can you can unmute yourself when we call on you to ask the question. But I'm going to go ahead and get started with one that I think is probably a lot on our minds is, and maybe each of you can just take a turn speaking to, I think a lot of people are wondering about the influx of people coming from other states. It's a little daunting. Like, I think a lot of us feel wonderful that we can be that for those people that may be a little nervous about what does that actually mean, and what does that look like? And I'm sure each of you has a view on that. Bethany, do you want to start, or?
Sure, I'll start on that. You know, part of the issue is wait time, right? So we have so many visits, we have so many providers, and we have wait times. So California is positioned to care for its state as well. Again, people might have to drive long distances, as well as influx, but of having an abortion at 8 weeks versus 10 weeks, 10 weeks versus 12 weeks, 12 weeks versus 16 weeks is a very, you know, can become a very different procedure. Prior to COVID, one of my, I was asked to go visit 40 clinics in what we would know would be the protected states. So what that meant was visiting the 2 clinics in Kansas, all of the clinics in Illinois, Montana. And when I visited those clinics, what they were saying was, some of them, we already live in a post-Roe v. reality. And this was before COVID. This is before the fall of Roe. And what they were saying is the clinics in Montana already took care of everybody in South Dakota, North Dakota, and Idaho. And so they have been dealing with people driving long distances. And I think our prediction is that people will fly, whether they'll fly to major and big expensive cities like San Francisco and Los Angeles, we'll find out. But they're most likely will be driving for their care. Again, that's what we anticipate. And so places like Southern Illinois, like Kansas, like New Mexico, will see an extraordinary influx. What we will see in California, I'm interested to hear Jessica and Shannon's and Assemblywoman Petrie-Norris perspective on this. But I think it won't be as dramatic as it will be for states that don't have as many facilities to begin with.
Yeah, I don't think I disagree with anything Bethany said, I mean, I think in a lot of ways, yes, for many of us, we already were living in a pre or post Roe world, and that was certainly the experience of many of our callers. I honestly think it's too soon to tell, and that tends to frustrate folks a lot, I think. But you know, our team has like a not so funny running joke every morning around like, okay, is Arizona providing abortions today? Like, a lot of these states have not solidified their laws yet, and things are changing rapidly. So even just where abortion is legal, where it's not legal, in the states where it is legal, how far along they're providing abortion care is changing day to day. So I don't think we can entirely anticipate just yet what that influx is going to look like here in California. I do feel very confident that we're prepared for it. And I think that's honestly because of a lot of the work that the legislature has done, and that the Future of Abortion Council has done. Of course, there are some more long-term things we need in terms of increasing our provider workforce, ensuring that it's a diverse provider workforce, you know, ensuring that there are clinics in every county in California. Those things are not going to happen overnight. But I think we do have a lot of the infrastructure in place to accommodate a significant influx if needed. Does that mean that it's not going to be difficult for some folks? No. Wait times are probably going to increase. You know, you may not be able to go to the clinic you thought you were going to be able to go to. You may have to go to a neighboring clinic or something of that sort. But I do feel like we have a lot of that infrastructure in place and are prepared for that influx. For folks who haven't seen some of the data prior to the decision, the Guttmacher Institute was anticipating that there would be a 3,000% increase in the number of people of reproductive age whose nearest clinic would become a California clinic. That doesn't mean all of those people are going to get pregnant at the same time. All of those people are going to need abortions or have abortions. But that's still a pretty significant increase in the number of people whose nearest clinic becomes a California clinic. And so I think that's really telling about not only what we can anticipate, but also the work we need to do to really ensure that we're prepared.
Yeah, I think that that's all right. And I would just add on the Arizona piece in particular, right? So the Guttmacher Institute, when they did look at that and this 3,000% increase in folks that could find their nearest abortion clinic in California, that was out of that group they're talking about, 1.4 million women of reproductive age would be an increase in 1.4 million women of reproductive age who would find their nearest abortion clinic in the state of California if Roe fell. 1.3 of those million are Arizonans. So the vast, vast majority of those people would come from Arizona. So Arizona, at least for the influx to California, plays a huge, huge role. And if Arizona is not a done deal, it is one of these states that could go either way. So right now, they have a super, super slim majority of anti-choice legislators controlling the state legislature, and they have an open governor's race. So you could actually, this electoral cycle, or Arizona could flip to being a protective place, or at least I should say a place with legislators who could be poised and a governor who could be poised to make it a protected place. But that's all dependent on what the outcome of this election looks like. The flip of that is, you know, there is a 15-week abortion ban that is actually slated to go into effect in Arizona on September 24th. So up until that point, abortion is legal in Arizona, but there's been so much fear in Arizona that frankly, our Southern California, especially Imperial and San Diego counties, have already seen a huge increase in out-of-state patients coming in from Arizona because clinics are providing abortion care one day and not the next, as Jessica mentioned. So it's just this landscape where there's so much uncertainty and fear, and people don't understand the legal landscape. They don't understand what they can and cannot do. They're scared, and provider networks are scared across the country. I mean, it's created this environment of intense fear. And that is one of the things we're grappling with. I think the only other point I would make is, so the Guttmacher Institute, through this study, they looked at proximity, but proximity is not always the best or only measure to evaluate when considering whether people will come here. Some people might come here, and we are seeing patients from Texas and Louisiana, all across the country, really. And that's because they might come here because it's actually easier to get on a plane and fly from Dallas to LA than it is to drive out to Colorado. Or they might be able to get an appointment more readily than seeking out an appointment in Kansas. So there are a lot of things that are factors in that whole landscape. And it's why some of these estimations of actually what will this influx look like are a bit hard to nail down. That really is an ever evolving and changing landscape for us to navigate and try to figure out, what that influx looks like now and what it's going to continue to look like moving forward.
And I guess I would so thanks for that, Shannon and Jessica and Bethany. Just add a couple of things, and please call me Cottie. I'm not Assemblywoman, but I'm actually really was grateful, Jessica, to hear you say that you do believe that we are prepared, because I think sometimes, across our California government, sometimes there can really be a disconnect between our policy priorities, even the resources that we're directing to, a policy priority, and what's actually happening on the ground. And I know when I've been talking to our providers on the ground, they also share that assessment that it's a lot. Things are evolving so quickly. It's kind of this, it's like almost like a war footing, right? Everyone's got to be like, ready to act, and ready to pounce so quickly. But they do feel like they are prepared right now, which I think is a really good thing. Because I think fundamentally, and we all recognize this, rights without real access are really meaningless. And so this question of real access on the ground, and where the rubber meets the road, is so important.
Thank you for all that. Go ahead.
I was just going to add one quick thing. I also thought it was very interesting that people think that Jessica mentioned this, that this is people think this is just a now crisis, but really this crisis has been going on for many, many years. The reality of the protection of Roe has been essentially non-existent in many states across this country, where, states have been able to limit access so significantly over the years that we had a handful of states with only one clinic in operation in the entire state. Well, if some of our states are enormous, that's not real, right? That's, as Cottie said, that's not access, right? And one statistic I think is interesting is before the fall of Roe, 1 in 10 abortions being provided in the country were actually, let me rephrase that. 1 in 10 people accessing abortion care were already getting it in a different state. That was before the fall of Roe. So we already had people doing some measure of having to seek care outside of their own states.
Great, thank you for all of that. We have a question from Sherry Mowbray. Sherry, would you like to unmute and ask your question?
Yes, hi, thank you. You are all amazing women and impressive, and I'm grateful that you're all on this crusade. It's so important. I had 2 questions. One is for Cottie, I'll call you Cottie, and that is, I was really happy, and I was not aware of the piece of the bill that you're working on that specifically goes after the social media platforms with regard to releasing private conversations. I was so horrified by that. I had been a very frequent Facebook user, and that was it for me. And I've been off of it ever since. And I think that is so hugely important. And I just would be interested to know more about where that bill is at and what kind of teeth you think that it will have, given that, yes, the technology companies are located here, and how much control does California actually have? So.
And I think we actually have some really good news on that front, because I think all of us were just absolutely horrified when we saw that one case, and that was clearly sort of just the tip of the iceberg and probably the beginning of a deluge. And so it was one of my colleagues, Rebecca Bauer-Cahan, who before she was elected in 2018, she was an attorney. And so she, as soon as that came to light, started working on this legislation that she was able to move. It's called like with urgency, which means that it requires a 2/3 vote in both houses of the legislature. And then upon signature goes into effect immediately. And so that was able to happen in our very, was it the last week of session or the week prior? And it was, with people with COVID still raging and people being on and off the floor, there were moments when she was very anxious, I'll be honest with you, about whether or not we were actually going to be able to move that legislation this year. Our legislative session ended at the end of August, and protect women across the country. And so that was, I think, a hugely important development, that we were able to do that. And so that is in effect. And we believe that legislation is very, very strong, and that it gives our California-based tech companies an ability to, because the reality is these companies didn't want to hand over that data. They didn't want to hand over that information, but they didn't have a legal leg to stand on to push back on those requests. Now they do. And so I think one thing that we are seeing is like, it feels like, the sort of anti-choice states do this, then we do this, and then they do that. And so I don't know that this conversation's over, but I do think that we have a lot of power here in California to protect that most personal information.
So that is in effect now.
Yes.
Oh, that's fantastic. I didn't know. Thank you very much.
Yeah.
Thank you. We have a question for Jessica. Cindy Wagner is asking, do you have adequate financial resources to assist all of those women seeking your help?
It's an excellent question, and not always a straightforward answer. Historically speaking, our Healthline has been primarily funded by individual donors. There has not been a lot of interest from foundations in necessarily supporting this type of direct service work, particularly in a state like California that is seen as so progressive. However, thanks to the work of our legislature and Governor Newsom, there are two funds that the governor has funded in his budget, one for uncompensated care, which essentially will ensure that providers are compensated for providing no or low cost abortions to folks in California and folks who may come to California to access care, which means we anticipate seeing a lot less requests for procedural support on our Healthline, because providers will be able to offer that care significantly discounted or free. And then there's also a practical support fund, as I mentioned earlier. That's a $20 million fund that can be drawn down over a number of years. And we anticipate being one of the primary organizations to receive funding through the practical support fund, which will allow us to hopefully meet the need of all of the folks who are in California and coming to California to access care. So we're feeling pretty confident in this moment. Like I said earlier, we've never met someone's full unmet need. Usually it's like their procedure's $1,000, they have a couple hundred they can put towards it, and we're able to put $200 or $300 more, and then we can help them piece some other things together, including maybe a payment plan with the clinic, etc. And same on the practical support side, in terms of we can cover a night or two of hotel, but we can't cover 3 or 4, etc. So we're really hopeful with the funding support from the state that we will be able to collaboratively meet the needs of all of the folks who are coming here.
Thank you, Jessica. And we will be putting a link to your organization in case people are interested. We have also another question from Pat Becker, and she's wondering, is there any place for vasectomy support in part of this movement. She's actually driving and listening in, so she couldn't ask the question. So whoever thinks they, or all of you, want to address it, I know it's been in the news quite a bit. And as a parent of childbearing age people, I'm interested to know a little more about that as well.
I can speak to one piece of this, which is that this year, one of the bills that we passed was SB 523, authored by Senator Connie Leyva. And this bill is all about contraception and seeking to ensure that we are modernizing our contraceptive system and also creating more equity across the system. And so one of the things that this bill will do is require that both over-the-counter birth control options and vasectomy services are covered without cost sharing. So we are moving in the direction of, at least in California, ensuring that that people can access vasectomy care without incurring, high costs to do that. So I'll just add that piece.
And I've heard of clinicians in Illinois who are trying to create a mobile vasectomy van and to try to do low cost vasectomies. One of the problems there is the access to urology and actually integrating it, like Shannon's speaking to, into family planning services in a greater way. So that there's a lot of interest in that from the clinician point of view.
Thank you. Looks like those are all for the questions from our audience. And Nancy is suggesting that in closing here, if you could each take a turn and talk about what are some ways that the public can become involved in addition to voting. We are assuming you're all would like us to all vote for Proposition 1 here in California, and being aware of other things that we can be voting for. And that would include, I would assume, looking at candidates. We don't endorse candidates in the league, but when you are looking to decide who you're going to be voting for, to be asking some of those questions so you know what their viewpoints are. But if you could talk to some of the ways the public can become involved in addition to voting, and then I will put some of your links into the chat, and then we'll finish with that.
I don't know who wants to go first. I guess I can go. So I'll go. Well, in closing, thank you again. Thank you so much for hosting this. Thank you for inviting me to join you. I also just want to say a huge thank you to all of our other panelists. So Bethany, Jessica, Shannon, you may have seen me like scratching down notes as you were talking, because I learn a lot anytime I join these conversations. And thank you so much for all of the work that you and your teams are doing. I think one of the folks who asked a question called it a crusade. And it is, and it's we couldn't be doing this without your partnership and without your leadership. So thank you so much. And to the question of how can everyone on the call get more engaged, and I think number one is making sure that not just that you're voting for Prop 1, but that you're talking to your friends, to your neighbors, making sure that people really do understand what is at stake with that proposition and are both supporting it. And also realizing that the stakes in this election are incredibly high. Sometimes people don't show up as the League of Women Voters will know. Oftentimes people do not show up and vote in these midterm elections. And the stakes are just too high on so many fronts, but particularly when it comes to our fight for reproductive freedom and justice. The stakes are too high for anyone to be sitting on the sidelines. And so we need to ensure that here in California and all across the country that people are showing up and making their voice heard. I want to actually, was it Shannon? I think Shannon, you said it's going to get worse, but that you fundamentally believe that it will get better, because we know the vast majority, not just the vast majority of Californians, the vast majority of Americans believe in the fundamental right to abortion care and the fundamental right of reproductive justice, of reproductive freedom. But it doesn't matter if the majority of people agree with us if they sit on the sidelines and don't show up. And so we need to ensure that I think that this really horrible, horrible moment for our country, that the silver lining becomes engagement, activism, and that we look back on this really as a fundamental turning point, and a turning point for the better, again, here in California and all across the country. But that's only going to happen if collectively we show up and ensure that our voices are heard in this election.
Yeah. So I mentioned this at the outset. NARAL is a member organization. So if you are not a NARAL member already, I would encourage you to become one. And I can put the link to do that into the chat. We are actually a very small team, especially here on the ground in California. It's me and 2 organizers who are literally our physical staff in the state of California. I like to think we are small but mighty, but we are truly impactful because of our membership. So please become an NARAL member. The next thing I would say is do make sure on the Prop 1 front, make sure that League of Women Voters and any other organizations that you think should endorse the ballot measure actually go onto the Prop 1 website. I just put the link for that in, and you can fill out this form so that your endorsement actually shows up on the coalition page. So I'll link to the coalition page as well. We want to be sure that any organization that has endorsed the proposition actually shows up as part of the coalition when people go to the Prop 1 website, so they can see the full list of endorsers there. And yeah, I think I would just, plus everything that Cottie said other than that.
Jessica, you go next.
Okay. Yeah, I would just chime in. I 100% agree with everything that Shannon and Cottie said. As Shannon indicated, yes, Access can always use financial support. So really encourage you to look into Access Reproductive Justice. We normally are inviting folks to volunteer with the organization. However, since June 24th, we've had about 7,000 volunteer inquiries to the organization. And our goal was to train about 200 volunteers this year. So we have been slightly overwhelmed by volunteer interest at this moment, which is wonderful to see. We have 1 volunteer engagement coordinator on our staff. So, and we have a very grassroots process and vetting process. So really encourage you to follow the organization and find out about opportunities to get involved. Please support Prop 1. It's hugely important to really enshrining the right to reproductive health care and abortion in particular in our Constitution. And I will say the one thing that I always ask of folks when I speak on panels is to have the tough conversations and do the culture shift work that is absolutely part of this movement. We need to, I always say jokingly, not jokingly, but that I say the word abortion more than I say my husband's name, which is actually absolutely true. But, being unafraid to say the word abortion, being unafraid to share your experiences with abortion, being unafraid to talk about it with those who may hold differing opinions from you. Abortion is part of our daily lives. It is part of healthcare. And some of the most important work we can do is really to destigmatize the conversation wherever we are. So in addition to everything that Shannon and Cottie added, that is my 2 cents, and I will pass it over to you, Bethany.
I would like to propose a challenge to this particular group because you guys are so politically experienced. It's really an amazing kind of fountain of political activity that's in this particular virtual room. And, Shannon made a really important comment that if you look at the numbers state by state, 8 out of 10 people approve of abortion. When we look what happened in Kansas, 67, what was it? 67, 23, no, 33, we have these numbers if we take it to a state proposition. And I would say that almost in every state, if we could get out the vote and have a proposition on it, that we will get over 50%. And so if that's the case, how can Marin County reach out? And again, maybe this is as individuals and not as the league, but how can you share the wealth of your information with states that are trying to get propositions on their ballots and helping them form those and with the language and sort of like having a sister county somewhere and think about how we can really, right now, we do have it on a few states, but I'm actually a little underwhelmed with how many propositions we have that knowing what we knew that Roe was going to fall, most likely, looking at the signs that Shannon laid out, the map that we knew, that you would have thought that the Democratic leadership would have positioned this on every ballot that they could have. And all of a sudden, what's happening is the right wing is realizing like, oh my God, if this gets on the ballot, we lose. And they are quite concerned about that. So if you have the time and energy, and I know you guys already have the experience and the knowledge, find somebody in a state who you can work with. Again, also let's vote on Prop 1. But that's my, I just think that this particular group is just so passionate and sharing your, decades and decades of wisdom. Like, let's do it. So thanks.
I love that, Bethany. That is great. I love that.
Well, I just want to say you four are so impressive. My goodness, we are so fortunate to have you with us and to have you doing this work. Thank you so much for both, for your activism, your advocacy, and for your passion and willingness to come talk to us. And I know you're doing this other places, and anyone who hears you is going to be ready to join this fight. I can't believe we're fighting this fight again, having grown up during a time when we thought we had solved the problem, but here we are. And thank you.